Do you suspect that your wrist pain is hormonal? You're probably right. Let's talk about that. Hello lovelies, welcome to another one of my videos in which we'll be talking about whether your wrist pain is actually hormonal. My name is Inga Fleur and I'm a fertility homeopath. I help couples to conceive naturally. So I love to talk about anything that is related to fertility, improving your fertility naturally, hormones and hormone imbalance. So this video fits right in with that. If these are topics that interest you, why don't you subscribe? I would love to have you part of the family. If you do subscribe, make sure to also hit the notification bell so that you are notified the next time I upload new content. So let's get into this video. So you are wondering if your wrist pain might be hormonal, and the quick answer is it most likely is, because there's probably a reason that you have connected something with your hormones with the recurring wrist pain. Now that could be you're nearing your period and every time that happens you get wrist pain, or you've just ovulated and you get wrist pain, or you have been diagnosed with hypothyroidism, or you have just gotten pregnant, or you've been pregnant for a little while now, or you may have already given birth and you're nursing and you're struggling with wrist pain. Well, let me start with good job on finding the connection. Apart from the hypothyroidism issue, all of the things that I've just mentioned and the wrist pain is related to the hormone progesterone. What you may already know is that under the influence of progesterone, you retain water, you retain fluids. This is why a lot of women that are just pregnant or are nearing their period or have just ovulated will often also have more swollen or sore breasts. That is because you're holding on to fluid. The same thing is happening with your wrist pain. If you look at the wrist, you've got the carpal joint. That means the wrist joint. And in that joint, you've got the carpal tunnel. And through that tunnel goes one main nerve, it's the median nerve, and 9 tendons. And these tendons go to your digits. Each finger has 2 of those tendons, except for the thumb. That one's just got 1. When you're holding on to fluid, that can also happen in your joints. And if that happens to be on your wrists, well, then that's kind of crowding out that big nerve and those tendons. When that happens, the median nerve gets pinched. And as a result, you may feel tingling in your fingers or numbness and pain. This is called carpal tunnel syndrome. Ah, you had already found that bit of information on the World Wide Web, hadn't you? Interesting thing is, if you have carpal tunnel syndrome, usually only those fingers will be affected, not the thumb. And this one, maybe only half. What can happen aside from that pinched nerve, though, is that because it's so tight in that carpal tunnel, that the tendons are rubbing against each other and they get a little bit agitated and irritated and can even get inflamed. So you can have carpal tunnel syndrome, which is bad enough and painful enough, but then you can also get tendonitis on top of it. This is especially the case if you are a nursing mom, because you are constantly picking up your baby and you're holding onto your baby, you're nursing your baby, so those tendons get a lot more exercise, a lot more than they would like. A good exercise to try and see if you actually have carpal tunnel syndrome, or as the cool kids like to call it, CTS, is to press your hands against each other like this. If that brings up the pain, that's carpal tunnel, baby. Another good way to see if it is carpal tunnel is if your symptoms come up before your period. Because once your period comes, your progesterone will have dropped. You won't hold on to fluid as much, so that will free up some space in the wrist, and that should remove your pain. Now, those of you that are hypothyroid are thinking, okay, great, but this is clearly not a progesterone issue for me. How is my hypothyroidism connected to my wrist pain or my carpal tunnel syndrome? Well, the thing is, if you have hypothyroidism, that means your thyroid is sluggish. Your thyroid is responsible for all the metabolism in your body, and that includes your fluid balance. If everything is moving a little bit slower, that means you're holding on to water a little bit. So the good news is the weight that you're holding on to, part of it is just water, girl. Now you would like to know what to do about it, right? Well, your homeopath is here for you. Let's talk about some homeopathic remedies that you can easily get anywhere. You can get them online from a homeopathic pharmacy, and the good news is they're completely safe, have no side effects. So let's chat about those. The number 1 pain remedy is arnica. You may know it as a remedy to use in case there's an injury or kids falling over or you falling over. So arnica is the remedy that you can grab onto in a situation like that. Might not be the best remedy, but if it's what you have, this is a good way to start. If you have been diagnosed with tendonitis more so than carpal tunnel syndrome, then you want to look at the remedy Ruta. Ruta is a remedy for tendons. And also wrist stocks can be useful because often the pain can also travel up and your muscles can get tight and sore, and wrist stocks is perfect for muscle aches. Actually, you can use it after exercise too, or if you have a sore back. Wrist stocks you can also use for sprain. So if you ever sprain your ankle, arnica for the initial trauma and the bruising, Ruta for the tendons, and wrist stocks for the muscle sprain and pain. If it is clear that the carpal tunnel symptoms are definitely related to holding on to water, then Apis could be a good remedy. Apis is a remedy that I often give to patients that are pregnant and that are holding on to water, and you can see it in their ankles. They come in and they say, "Can you help me with these cankles?" Again, because in pregnancy, progesterone is surging together with other hormones. Women tend to hold on to water, and Apis is definitely their remedy then. Another remedy that is fantastic for fluid balance is the remedy Natrum muriaticum, or Nat Mur. I usually will prescribe this remedy to somebody that looks like they have an Apis picture, so they're holding on to the water, but at the same time they're somebody that is very reserved and maybe they have experienced something emotional, but they haven't actually processed it. Anything with grief, it can be deep grief, but it can also be recent grief, or maybe they're just generally reserved, then Nat Mur could be the best remedy for them. And then I have two remedies with the letter H. One is hydrestis. This is a drainage remedy. You can use it for so many things. You can use it if somebody has sinusitis. I tend to give it alongside something that is more indicated though. And obviously, if there's fluid, you want to drain it. Hydrestis can be a great supportive remedy. And then lastly, we've got the remedy hypericum. And that one makes especially sense if you've just gotten the symptoms, because hypericum is a nerve remedy. I love to use it for patients that have had dental surgery. It's a fantastic remedy for women that have had backache since they had an epidural, but it's also great for that median nerve that is being pinched and is sore. Make sure not to overdo it on remedy use. Try a remedy and see how it goes, but don't take it for weeks in a row. That's not clever. If you're not experiencing any relief within 24 to 48 hours, it doesn't need to be gone, but it needs to be better, then it's not the right remedy. So try something else, or even better, contact a homeopath and schedule an appointment. So the second thing you can do is use a splint. So something like this that will stabilize the wrist so that you cannot move it around too much. What that does, it prevents you from moving the wrist like that so that it doesn't get so tight there, and that you cannot have as much of the pain from the median nerve being pinched, and the tendons don't get aggravated as much. This is great both for tendonitis or for carpal tunnel syndrome. In extension of the splint is just rest. Don't sit behind your computer for hours. Watch the way that you're using the mouse. Don't overdo it. But you also don't want to hold it still constantly, because then the fluid can't move because there's not enough circulation. So make sure you use those fingers. Make sure that the blood supply and the circulation keep going so that the inflammation can be removed and healing nutrients can be sent there and the fluids can be removed as well. And then lastly, what can help is icing, because we all know that through icing, swelling can go down. And also, if the tendons are actually inflamed or the nerve has gotten inflamed because it's been so irritated, then icing can bring down the inflammation. However, as a homeopath, I always say, go with what your body says. Your body knows better than anyone else what it needs. So if the icing makes you stiff and sore, don't go for that. Even if it's the opposite, if a hot water bottle helps you, go for that. Even though everybody says that it promotes inflammation, go with what your body says. Everybody is different. So to summarize, you've got your remedies for your wrist issues. You've got the immobilizing with a splint, possibly resting, but making sure you move around enough, and possibly icing. I really hope you found this video useful. I struggle with wrist pain sometimes, and it's definitely hormonally related. And these suggestions really make the healing process so much quicker. If you're struggling with finding a remedy that is appropriate for you, or it's a recurring issue that you're getting because of the hypothyroidism, or you're getting it after ovulation or premenstrually, then it might be good for you to start on some homeopathic treatment and resolve that underlying hormonal imbalance. Because if you resolve that, then you will resolve the wrist issues as well. If you indeed enjoyed this video, please hit the like button, because it really motivates me to know that you like what I'm making and what I put out. And it also lets me know that you like content like this, so that I can make more videos like this one. And in the meantime, see you in the next video. Take care.